Governor, does the SHA cover outpatient? Because in many counties we moved around and they're not covering outpatient.
They only do level 2, 3 and select level 4s. I was in the hospital, one of the hospitals, Makueni, and people are facing lots of challenges. About the referral system is unclear. There are people who don't understand it. This level 4, level 2 is a matter unknown to most Kenyans, so they don't understand why they cannot walk to a hospital and get services. They are told, go back to your village, get a referral, and then come here, which is yet another expense. By the time they finish, they are told, we are only going to cover a portion of your bill. We will not cover the entire. So the excuse that SHA has teething problems is a matter, I think, because this function is a county function. And this social health insurance is supposed to help the most vulnerable community. And they are the majority of Kenyans. I would urge the senators to consider this as a matter of national emergency for purposes of addressing, because it is causing a disaster.
NHIF used to take care of everything. I'm sure now the counties are facing difficulties with the, Linda Mama issues, and also NHIF used to cover cancer almost 100%. SHA is not covering. I have so many issues of patients calling me to ask me what they will do about it, because they are in hospital, it has not covered, it has only given some little amount and they have no money. And again, they are also demanding that the patients pay for one full complete year on entry to every hospital. I mean, it is meant to help the poor, but it is not helping the poor. I mean, something must be done, otherwise people are suffering in counties.
I was the chair of the Legal Affairs Committee of COG when SHA was being debated, and we raised this concern. We raised this concern about the transition and how the counties and the facilities in the counties will be protected from this obvious problem. And in fact, it has led to a lot of debt. Mr. Chairman, unfortunately, we were not heard. Unfortunately, we were not heard. The transition from NHIF to SHA has caused problems that have not gone away. And they will still not go away, because I don't think that the transition should have been done without proper accountability as to what they owe, whether it is a faith-based hospitals or the public hospitals. Minus all the things that they call fraud, there are still genuine claims that have not been paid to date, both to ourselves and to the faith-based hospitals. It's a problem that must come from the floor, so that the current SHA management can be held to account on these issues. The idea of forming committees to discuss things that are legitimate is another form of delay.
Can we invite the CEO of SHA to give us a status report and a strategic understanding in terms of timelines with regards to outstanding payables they have to counties? Sorry? Yes, and that's what I mean by the strategic payment plan, and that will include the schedule and the timeline to all county hospitals. I think this will be the way to go. So invite the SHA CEO to just come to this Senate and tell us what is the status report. How much are they owing county hospitals?
It's about 9 billion.
Yes. Yeah. And what is their plan to pay that money within what timeline? Then we will also invite COG as an interested party.
As you do so, Chairman.
Yes.
Call KEMSA.
KEMSA as well.
So that the money that is owed to counties, part of it settles the KEMSA debt. I've mentioned that out of the 47 counties, only 2 counties have a zero balance. That is Makueni and Mombasa. And therefore, it must be a complete exercise, so that then the commodities, part of the commodities problem counties are facing is a result of the money owed by by the defunct NHI.
We really worked very hard as finance and budget to push the allocation this year from 387 to 415. It was quite a battle, but sometimes we also face challenge from the COG because it becomes a battle of senators. I know that's our role under Article 96, but we need more support because I can assure you when National Assembly sticks on giving counties 405 billion, they have the executive at national level backing them up. We don't feel the same backing from COG. In fact, COG sees us as their enemy, when actually we're just here to actually help protect the counties and bring the monies. You can actually see in the face of...
So we have a big challenge. So, Chairman, we must continue. When we said 465 as a basic minimum for shareable revenue, and we got 415, we are happy we've got a slight increase. But I can tell you, in the bottom line is that it will make very little difference in terms of the healthcare.